Now we look at another study that's like another practice. You say it's a practice or a study. So this is in radiography, and this is the aspect of wedge filter. So we're trying to look at what is a wedge filter and why do you use a wedge filter. So if I just give you a summary of what a wedge filter is let me say you have a place like this, okay, and this down happens to be thicker than the front. So a wedge filter, you bring it and it's having a thicker side and a thin side. So you take it opposite. The thick side will be on the thin side, while the thin side will be on the thick side. This is because you want to ensure that what the X-ray spread, that's a beam spread, is uniform. So it's a type of compensating filter is used in radiography to improve imaging qualities. When the anatomical regions, they vary in how thick they are. So what is a wedge filter? It's a beam modifying device and is placed between the X-ray tube and the patient. It's shaped like a wedge and is designed to attenuate or reduce the X-ray intensity, okay, which could be you are directing the X-rays to be more in thicker regions, while to be less in thinner regions, just like I was explaining to you guys. So on the chest, you could see that the sides of the chest are thinner, while the middle of the chest, that's mediastinum, is thicker. You understand? So that's how you do it. So it helps to produce a more uniform image by balancing how the different parts of the body are exposed. So purpose in radiography is to compensate for uneven tissue thickness, reduces overexposure in thinner areas and underexposure in thicker areas. It improves contrast and diagnostic quality without increasing patient dose unnecessary. So common clinical application is chest imaging, which balance the exposure between lungs and the mediastinum. We have the spine imaging, which equalizes what exposure between cervical spine and the shoulders. We have extremities. It's used when imaging limbs with varying thickness. We have digital radiographic systems, okay, and all of that. Advantage is you have a more clear image and a more uniform image. It will now help you to be able to do a diagnosis accurately and to reduce need for any repeat exposures. Repeat exposure just simply means I did an imaging for a patient, but it was not done right. So I'm still telling the patient to come back again for the imaging, which should not be nice. The patient might spend more and also is more uncomfortable.